Okay, so we are live. Thank you, Victoria. I guess I didn't give you a good enough heads up here. Sorry about that. So my name is Shirley. This and Victoria here are the Upstream Intelligence podcast co-hosts. And today we're going to be really going deep down into how we can use thermography in optimal patient care and why collaboration with different practitioners is so critically important for overall patient health. So, what our intention is with this podcast is to help people open their minds to different ways of approaching different kinds of problems. Victoria has developed over the last 20 years a really robust software that will upload all kinds of images from her thermography practice and overlay it with dental photographic images and putting together a story that will help support the dentist, the myofunctional therapist, the thermographer, reader person,
Mhm.
the ENT, the this, the that. I mean, it just goes on and on. All the collaborative partners that you would need in a kaleidoscope of collaboration. So this is let's just dive right in because it's already on the screen and stuff. So this is part of the Dr. Link software that you've developed. And can you kind of tell us what we're looking at right now?
Sure. I'm assuming that I'm sharing my screen.
You are sharing a screen with some skeletal somethings and then some super colorful image
Yes.
either
Okay.
under it or
Well,
over it. I can't tell.
yeah. And basically, what the software is designed to do is to highlight the stresses in the neurology systems in the body. And I designed it so that the dental industry can use it in the head and neck area, which is extremely advantageous. And also in wellness clinics where a lot of women want to know about the influence of breast cancer from lymphatic drainage blockages that could be coming from the mouth. Now, interestingly enough, dentistry plays a role in the healthcare industry 150% of the time.
Mm-hmm.
And what the research and development I've seen over the last few years, they've talked about oral systemic, but are they really talking about it in a way how to address it? And what the role is of a dental office, what the role is of a chiropractor office, a massage or a body work, or a myofunctional or a myofacial, and also medical or wellness or nutrition. All of these factors play a key in the healing of the body, but more importantly, the assessment. So, how I see the future of dentistry is taking the lead in the assessment for the neurology in the head and neck. End of story. We are the ones that see inside the mouth, we see the neurology in the teeth quicker and faster than any other healthcare professional. What we have here on the screen is a back of a neck, and right here is the vertebrae, which we call the atlas, where the head sits on an atlas. And where the interesting part about it is, as the person's chewing, the TMJ rotates either correctly or incorrectly, depending on the occlusion of the teeth and the stress that it will put on the joint and into the back of the neck where they call the atlas. You can see this outline of an atlas here. And as I place this particular case here, her atlas is on fire. Her atlas here, and this is interesting here because we have the way to show you here the atlas where this particular case is her atlas is highlighted, outlined, stressed. Now,
Wow.
you might say, well, that's great, Victoria, but what about, um, what's her mouth look like? Well, let's look inside her mouth here. you can see just the way she's chewing on her teeth here that she's not getting enough balance in the joint of the jaw, and she's missing teeth. She's missing molars here. So she's off balance. And that's going to stress the atlas in the neck, which puts the compression on the nerves. And
Okay,
those
can we
nerves
just
can't fire into the brain and into the central nervous system. You see some heat
let's
back
take a
here on the back
break
of the
right
mouth.
here, because there's a lot more going on in the mouth that you don't need to see that contributed to this little nightmare of this woman. How old is she?
She's 75,
Oh, geez.
and her
So
systems are shutting down, by the way.
they are, but look at, she doesn't even have the right number of teeth, period. She
You're right,
doesn't, it
Shirley. She
looks
does not.
like she has three incisors on the lower arch. And then so then they're all crowned. So somebody took out one of her front teeth because of tooth crowding,
You're right, Shirley. And one of
right?
the areas that the dentistry is really ignorant about is they call it extractions, but they're really amputations of a nerve. Yes.
Oh, for sure. Not only that, she's missing a premolar. Is she missing? No, she's got her premolars. One is like tipped way out.
Yes.
So that we don't even know how that occludes. So as it was erupting into the mouth, it would have established its own occlusion. There's no reason to touch that tooth with a burr to to fine tune the occlusion or whatever the way that the teeth come together. But her tongue doesn't work.
No.
This is the beginning thing. If somebody would have looked at her tongue when she was either an infant, so that's our first chance to do some benefit for
Hmm.
this cranial nerve here and for this atlas.
Absolutely.
Two, two would have been about 5 years old when,
Hmm.
she's starting to shift into permanent teeth. And then the next chance would be maybe at puberty age
Right.
when things are really starting to be so
Shift.
active.
Hmm.
So she spent 1,000, 2,000, 3,000, 4,000, 5,000, 6,000, 7,000, $8,000 in 1980s money. Okay,
Yeah.
just on her lower teeth, not including the extractions. And we don't even see the upper teeth in here. I'm sure it's another eight. So that's $16,000. And all of that turned into this enormous nightmare in her cervical vertebrae. And that is what's showing up as a hot spot um, on your thermography images. It's, oh my God, look at that. Oh, this is where we're both hygienists and we're both like, oh my God, prevention, prevention. And then we get into the real world and prevention talks into a freaking flossing lecture. And that is criminal. I am so sorry. It's criminal that we only talk about flossing and fluoride when this person is starved of oxygen since birth.
Oh, you're absolutely
So
right.
her brain is affected. So she is
Yeah.
also probably has sleep apnea
Yep.
just from her teeth.
Yep.
Not, and those are not the first crowns she had, so she's had her crowns replaced, I'm sure, at least once if she's 70. So there's so many more things that we could prevent to get to this stage that you're showing us here on the
Look at this,
on
Shirley. This was what
these
she wanted to
issues.
find out.
Okay. Oh, sinus issues? No surprise there. If your tongue doesn't work, your sinuses can't work because they're never going to be the right size for your genetic potential.
Yeah.
This is a great teaching case. I'm so glad we thought about showing this one today.
Right. And
She wants to
look at her
sleep
magic
better.
wand.
So, as
She
part of
more
your
energy.
software, you have what their actual complaints are. And if they
Yes.
had a magic wand, what would they want to
Yeah.
change first? And how would that look for them? So, for
Yes.
you to be able to have a place in the software to put that in, I think is genius. And
Thank
patients
you.
really respond to that, I'm sure.
Well, it came after years of listening to patients. As a dental hygienist, we heard one story when the dentist walked in, and we heard another story when the dentist left the room. And over the years, I said, wait a minute, what's the truth? The truth is here. This is what they really want. They're complaining, but really what she wanted was more energy. You nailed it when you said, about her sleep deprivation. Um,
Hmm.
and then right
And
here,
the
she would have,
hygienist yammering about brushing more. I
yeah.
would have brushed more. She's owning her disease. That is such a load of crap. Hygienists are horrible about blaming patients when they have so many more tools at their disposal.
Well,
Okay, so let's go back to my blood pressure just went up a couple notches. So let's go back to what you wanted to show on the cervical vertebrae, in particular the oh my gosh, look at all of this information we can get from this patient.
and well, this is the back of her. I mean, that's her full body here. And isn't that
You can
interesting
see
that it's just on that upper area there?
it's
Um,
on fire. So let's just talk about the colors for 1 second. So red is warm, and that camera is taking pictures of different skin temperatures. And
correct,
when there's a problem, the temperature is going to be reflected on the surface of the skin. And
correct.
red is warmer, but look at if you go up the what you call it here, this little color graph thing, the
Here,
the hottest temperature available is
white,
white, is a
right.
white color. And that's what's happening to her cervical vertebrae in particular. uh, Hold on. So the atlas is coming up in this really dark red, right? And then what is exactly the white that we're looking at? Is that the axis?
The white is higher stress. It's a higher
Right, but what
stress.
bone is it connected to? Or
Oh, this up here is the
what
atlas,
anatomy?
right?
Okay, so the white is the atlas. Okay.
Yes, and as I get the atlas here, um, atlas
And
vertebrae.
then on
Okay,
the skull. So this is all part of the software. So on the
yes,
skull, you were able to click on that
right here.
vertebrae and turn it dark brown or
Yes,
gray or
uh-huh,
whatever color we're calling that.
right.
Okay.
And then
So,
overlay it
and then you
with,
overlay that and then make it be less intense and a little bit see-throughy. And then you
right.
can
Uh-huh.
line that up.
Yes,
So, yeah, we have a little discrepancy in the sizes there, but that's easy enough to change too, because everybody's going to be a little different size.
yes,
Wow.
uh-huh. That's about as
Wow,
far as I
wow,
can get
wow.
it. So she's got just even if I just highlight here, um, the the actual her area here at the base of the skull is showing here
Hmm.
that her stress and her chewing is outlined from her vertebrae. What I'd like to do is use this here system and get the neck here. Let's see, get this
Okay.
neck here. Okay, we'll
Yeah,
use the neck
let's
here. This way I can
zoom in on
enlarge
that.
it.
Yeah.
There we go.
So if you
But
took these images 3 days apart, three times in 3 days, it would look pretty much the same.
it would. And
Hmm.
that's what's interesting about these cases is that, you know, these
Yeah.
doctors can use the software to look at it, rotate it,
Yeah.
see what's going on and happening in this,
With no radiation. So
with
this
no
is what we're
radiation.
getting.
Right.
This is
Right.
what we're getting on a CBCT, which is still low radiation, but it's still in there.
Yes.
So this gives us a little bit of an opportunity to really get into the skull of the person
Well, and it also gives a visual for the person as well,
for
to
the
see,
patient. Yeah.
what's going on in as far as that area of, stress in that. I mean, you could just see
Mhm.
that outline of
Yeah.
the vertebrae. She's so out of balance. It's just crazy. And it also puts that stress where she was talking about on her neck, you know? And
So how did she come to you? What drove her? She had a pain in her neck, and or did she come for mammography and decided to do the full body, or how did she come to you? Was she a pain patient?
I work with a person that does what's called, he does neural matrix release.
Ay,
And
ay, ay.
so he'll go in here and work with cases where she's got the nervous system and the nerve circulation
Mm,
issues. And so he requires these kinds of scans because he
wow.
says it helps with his treatments. And he says he wants to be able to measure it so he can work with her over time to see
Yeah.
increase of circulation and take the stress off of these, areas where she's got the um, blockages.
Is
So,
it possible to repair that without repairing her mouth and getting her tongue to work right?
that's a great question. And I've had this conversation with this particular person, where we talked about this, what kind of, you know, um, what kind of cure? And the answer is yes and no. Yes, you can increase the circulation,
Yeah.
but as soon as she starts chewing,
Yep.
she's going to chew her neck right back out of alignment. So she
Yes.
really needs a dentist to work
Yep.
with that is plugged in
Together. Yeah.
to the neurology with the body work. And then somebody like you that works with the whole system to get the body back into balance and the tongue and the muscles retrained. You need a team. You need a village. That's the end of story. To just to be able to focus on one area, I've noticed, no, it won't work. It
Yeah.
you need a way that in these cases here, uh, I mean, no matter how much you look at these cases, you're going to
Yeah.
need to work with a team. You
Right.
to be able to, to say that, oh, well, I'll just work on, the equilibration of the teeth is
Ugh.
critical to,
Because the dentistry has jacked it up. If you have
thank you.
natural teeth, you shouldn't have to worry about it.
You
I'm
you you
so
you
like
you
over
just
this
nailed it.
equilibration conversation.
Yeah, the dentistry jacked it up and got the neurology so inflamed that over the years, she's shutting down the communication system.
Yes.
So she hires this guy to fix her neck and she feels better and she's got more energy, but
Hmm.
it doesn't last.
It can't last.
So what we have,
Okay.
Shirley, is an opportunity using this
Yeah.
kind of scanning system to correct them over time. This that you're going to always need to image a person. Someone like her, she's going to always have to be in maintenance. We're going to always have to monitor her stresses, and she's going to have to be working with a team. And this is where dentistry has to get out of that vortex that they're working by themselves. No more.
No, we
Dentistry
need
has
to, and these are
left the
images are
mouth.
great. They really go in line with this idea uh, of this kaleidoscope of care providers. Sometimes whoever's in charge of red is going to be more involved than the person that's involved with the yellow or whatever. That and it's always changing. And you have to kind of keep on top of all of it. So the practitioners need to be in communication too. This
You're
is
absolutely
this
right.
is
Yeah.
really, really huge. Now, I want to be fair. I mean, we were pretty like throwing dentists under the bus right now, but they are never tested on neurology. They're never tested on even microbiology of the oral cavity before and after any treatment.
Yeah.
They're not never taught about doing blood tests for any patients.
Right.
They get graded if the margin is good around whatever filling they put in. That's their bar.
Oh,
And does it
yeah.
hurt still, right? So this is they so this makes them a safe beginner when they get out of dental school. And it makes you a safe beginner when you get out of dental
Right,
hygiene school and medical
right.
school and all those things. But that's where you really start your education, because every patient is different. Every patient is different every day. I've just been feeling like crap lately. I'm like, what is happening? What is happening? Well, I ran out of this stupid medication, which I didn't think was doing anything. And I was like, and now I finally got my prescription back, and I'm like, holy crap, maybe it was just because I was not used to not having this extra potassium citrate in there.
Yeah.
So this is how we have to always be in communication with not just the patient. We cannot expect a 70-year-old, a 40-year-old, a 20-year-old, a 12-year-old to remember what the doctor said 2 visits ago for them to tell you what the doctor said so that you can put it into your think tank. The treating practitioners need to communicate. This is the perfect tool for that level of communication. These are the 3 months of images, the thermal images with zero radiation. We can track how much better this is. Look what happened when you did the arch expansion, and now all of these redder areas have been relieved. It's just so awesome how we can put all these things together.
Yes. And what's exciting is, when you talked about your think tank, what's an ideal think tank? I have been wrestling with this.
Yeah.
We get out of school and we're taught in a certain regimen. How
Mhm.
can we as leaders introduce a regimen that has the neurology in the upper cervical or upper body, and actually the whole body, the cranial nerves? What does that look like? I
Yeah.
mean, where in the insurance codes, where in
Ay,
the
ay, ay.
regimen and the protocols? This is the complaint I hear from dental hygienists is, this is great, Victoria. I would love to be able to, take these images and educate and work with a team, but the dentist is not interested, because
Right.
it doesn't look like an income stream. So, Shirley, what do you recommend?
I think this is an income stream. What we have to realize, and I was just answering this to a hygienist whose dentist wants to cut her time with a patient down from 90 minutes down to like 45 minutes. And she's like crying about it and blah, blah, blah. And I'm like, what are you doing in that 90 minutes? What, if all you're doing is cleaning somebody's teeth and you're charging out $120, 60% of that goes towards overhead. So you're not making money for the business. If there's no money coming in for the business has to close and you don't have a job. So you need to be on top of it. The missing piece is in the dental software, we
Mhm.
don't have a real good place to say that Shirley recommended blah, blah, blah. These numbers of treatments that would be beneficial for the patient. And so this here would really highlight a full mouth rehabilitation for this patient
Oh, but
for
definitely.
real. So in the 15 minutes or 40 minutes it takes to take all of these images, and really we only need the head, I guess, until something shows up and then you can take other body parts. But in this amount of time, this is going to turn into dental dollars, right? This person needs dentistry more than she needs whatever this guy you just said, this neurological guy, right? Because all of it is coming from her mouth and it started with her tongue. And so that needs to be, to me, that's the root cause. He's going to go, your neurology guy, or what did you call him? It was a really interesting, I should have written it
Neural
down.
matrix release.
Yeah, all of that needs to happen, but it can't happen if all of the structures aren't supporting the
Ported.
whole thing. The support
So,
is not there.
how do we help the information disseminate out there to teach? I'm not teaching the dentist to create these kinds of support here. I mean, obviously,
Mm-hmm.
there has to be a support in the occlusion, and taught in a way that is revolutionary. And where is the revolutionary being taught and by who?
Well, I've been following this airway thing for a little while. So let's see, it was maybe 2000, seems like everything happened for me in 2004. So let's say 2004 or six or something. So the early 2000s, I was a member of an organization called the World Congress of Minimally Invasive Dentistry, and I was awarded the leadership award for that meeting. And so that was very, very cool. But that group disbanded because they wouldn't, I don't know, for a bunch of different reasons.
Uh-huh.
Nobody talked about airway except
Mm.
Scott, whatever his name was, Dr. Scott. And I was like, whatever. And everybody else was whatever. Turns out that was like the pinnacle, right? It's
Mhm.
the top thing that we all needed to be worried about. It took until 2014 for me to get like, holy moly, how did I miss all of this? Because it was never really explained. What helped it explain for me was a different organization called the Academy of, hold on, AAPMD, American Academy of Physiological Medicine and Dentistry. And that organization has been building and building, but it's all on this airway talk. They're not really talking, and that was something I mentioned a few times already. In 2014, when I was first exposed to this, I was looking at all these CBCT images of these people, and every single one had a bad neck. Every single one had a bad neck, and nobody was looking at the neck, and nobody commented on the neck. It was maybe 2 years or 3 years later, one person said one
Mhm.
thing, oh, and the neck is crooked, you know, and that was it. That was as far as they went. So maybe, I don't know. I hate to like glom on to one of the organizations that might be open to this topic. Um, together, or starting your own organization. But then we're fighting with the AASH organization, the craniofacial pain organization, and you've got the AAPMD, and you've got the International Medical Toxicology Group, and you've got the
Right.
holistic
Yeah.
dentist, and you've got the biological dental hygienist group, and you've
Yep.
got all of these groups, and they're all like right around the edges. They're
Yes.
each of the things that we've been talking about as part of
Yes.
a collaboration, but
Yes.
it sure would be sweet. And I tried to get these organizations to have a joint meeting where they're all there. They share the exhibit space, they share the food space, they have their own speakers, and people can go to whatever speaker.
Wouldn't
And
that be fun?
that worked for a little while, but then there was infighting. And I'm like, what is going on here? This is stupid. Hold your damn meetings and hold them together so we don't have to all go across the country and lose a week of production every month because we have to go to another meeting. Not only does it cost to go to the meeting and stay and eat, you are not producing, and then you don't have enough time to put everything together so that you can start turning all of that education into patient care, which turns into money. And I hate to always go back to money, but the one thing that I learned from one of the little organizations I was a member of for a time, there's no mission without margin. You cannot treat your patients if you are working at Walmart bagging up, you know, stuff at Walmart for $10 an hour or 15 or whatever, pick a number, because you have to pay your mortgage. You have to pay your overhead. You have to pay for this. So you have to pay for that. And that should come from the patient care. And that can be extremely expensive for us. And it makes us struggle with how we can treat more patients with the more collaborative way of treatment. I
Well,
actually just
one of
had this conversation yesterday a number of times.
really, well, one of the areas that I've seen with this kind of patient care and having offering these scans um, is the treatment. People see the information, they see the discrepancies, they see the stresses. Right away, they want their magic wand fixed. She wants more energy, she wants to sleep. She's going to find the cash to pay for it, to get what she wants. And putting the team together, I was able to put this in the software, collaborating teams. Where I struggle is communication,
Right.
and finding a dentist that is part of a team player in this whole
Yeah.
equation. And you don't realize how much dentists are needed until you don't have them. And I, I've recommended dentists with these scans, and the dentists don't contact me. They don't say, you know what, I'm interested in this. Come to my office and let's talk about it so
Right.
we can understand it and give
Yeah.
a correct treatment and work with a team. I never hear that. Now, I don't even hear it in the chiropractic world. I don't hear it from a lot of these doctors. They're like deer in the headlights. They get the scan and they're deer in the headlights. So what I have seen a need is, all right, you guys are going to have this information. People want it. So we're going to provide it for them. We're also going to do some videos. So you can watch some videos and be trained on the videos in-house, so that you can have an understanding of what this is. They are so unplugged about the neurology and the neural matrix and the cranial nerves and how the cranial nerves are plugged into the teeth. Dr. Fonder's work, I mean, they are so removed that they're so stuck in their own vortex from their schools. Okay, school's one thing. You're out of school now for 10 or 15 years. I'm
Yeah.
sorry, but information is changing. And information about on these scans is going in the direction of circulation. Everybody has to have increased circulation in order to get rid of the brain fog, in order to get rid of the shutdown in the digestive systems and the vagal nerves.
Right.
And Dr. Rosshauser, he's one of the famous medical doctors on YouTube, is forever talking about this. And he's using thermal imaging, he's using ultrasound to show, these cases. And his minimum fee just to see him is $4,000. This is an ear, nose, and throat surgeon who figured it out, that the circulation and the neurology and the teeth and the whole head and neck area. And he's an MD, he's not even a dentist. And
Yeah.
he's working with taking the stresses off the neck. $4,000 just to visit a consultation, not even a treatment. So these people that are going into the world of circulation and the neurology better game up, because it's not going away. The information is there, and dentistry is needed. Even this ear, nose, and throat surgeon, he's going to need the occlusal plane supported. He's going to need the right dentistry to support his work
Yep.
in the neck. How can this happen if the dentistry is not on board with the future of the neurology here? And they're dabbling. I hear they're dabbling, but really, Shirley, how do we get them into the world of knowledge of actually working together? I mean, they're on the fringes. All these different organizations are on the fringes.
Yes.
And there's like Dr. We talked about Gerald Smith. He's got
Yes.
his educational videos and DVDs. But that's one person. How do you get this information out there as a staple? That's what I want to know.
Well, yeah, and we're open to any input. So
Yeah,
if you feel motivated, you the listener or watcher, if you
right.
feel motivated, please share this episode. I think this one is really, really good. And maybe the most important one, as we've been ramping up into these kind of topics, we have an actual like holy moly kind of a moment here with this case. This was a great teaching case. And I think what happens with some of these doctors, and they put out these DVDs and stuff, and I remember watching some DVD series for periodontal disease for at one dentist's office. And, you don't, you need support. You can't, especially as a hygienist, you can't just do stuff.
Uh-huh.
You have to have okay by the owner of the practice. And
Yeah.
until dental hygienists can have their own practice in the rest of the country, it's really hard to just apply some of the knowledge that you're getting as a hygienist. Same with dentists. Okay, so now about all this neurology and blah, blah, blah about the neurology. And then they're like, okay, I guess I need this is what I did. I need a chiropractor because they are like the neurological people, as close as I could get to one, because I don't want to have to remember all the cranial nerves and everything that I'm doing and how that's affecting everything. And it took me a long time to find the right kind of chiropractor. So we're all in these little islands here. We're all
Yeah.
looking for one another, and we
Yeah.
don't all have easy access. And now, I can see my patients virtually. So that's usually not a problem, but it's almost impossible for a chiropractor or your neurological guy or
Mhm.
most of these other
Oh,
people to see patients
hands-on.
virtually. So we
Mhm.
need to recreate
Network.
them.
Hmm.
We need to recreate Dr. Samuel and how she's treating inside the mouth. And we need to change apparently some laws. Some chiropractors are actually barred by statute for going into the mouth at all. So that's dumb. And then there's just a bunch to do, but you and I can't do it all. We're just at least flag wavers and we have some
Right.
solutions, but we need to get everyone together. And you can be at some of these alternative kind of groups. We could have a booth at the group and we could start to combine different fractions to work together and recreate some of the people. That kind of thing can happen. You know, we talked about having a school and then cha-ching, cha-ching. So even an online school, you still need others to talk to about it and work your way through in your own way of thinking. You can't just take these webinars all the time
Right.
and
And
apply.
what I see needed is application. So
Yeah.
when you are trained in the neural matrix or you're trained in these systems, in the biosystems to evaluate them, what are the protocols in office and what are the appointments? How much do you charge? I mean, these are the details that I'm hearing from these practitioners to say, I don't know what to charge. I don't know how to pull it in. Where do we put it in? I clean teeth. Where do I put this in? And in a cleaning teeth day. Where do you not put it in? So
It's,
it's a whole
we need to
mindset.
start there. Yeah.
Yeah, and it's get out of the mouth and into the body, so that we can be whole person care versus just mouth care. And mouth care is, I mean, here's a case here where look at all the mouth care that they did and look at her neck.
Yeah. No, you're not screen sharing anymore. But yes, we do
Oh, okay.
remember, and I was just thinking, I belong to a lot of Facebook groups and I don't visit them every day, but there's one called Ask a Dentist or something like that. And the kid is like 8. The kid has an open anterior bite, so the teeth
Okay.
don't overlap in the front. And the upper teeth are on the inside of the lower teeth. And there were a couple of other things. And I don't even remember what she was asking about. Oh, she was asking about the color of the teeth. Why are they this weirdo kind of translucent color?
Uh-huh.
And so all of these dental people are like, rah, 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 and all these different things. And I was like, this child needs to have their tongue assessed. They probably have a tongue tie. We don't see the tongue. How do you see the tongue? Where do you see the tongue, Shirley? Blah, blah, blah. I'm like, you don't need to see the tongue. This is the exact case that you just showed with this lady.
Yeah.
This kid is going to be that lady when this kid is
Oh, yeah.
70 if
Yeah.
something doesn't happen right now. The tongue
Quality of
needs to
life
be
is
trained
affected.
to be in the right
Yeah.
place. Yes.
And quality of life for her is
It's
decreasing.
awful.
And she's losing in her 70s. She should be walking and you have the energy. And it is sad that dentistry is contributing to a lower quality of life when it could be the opposite,
Yes.
contributing to a higher quality of life. How do we get that message across to our dental professional peers? I have struggled with this over and over and over and over. I don't know what I need to do differently. I've created the scans, I've shown them. The doctors seem to be very excited. But then when it comes to implementation, there isn't any kind of enthusiasm, or there's a fear of change. Well, how do I, what do I, and how, all these questions come up. So then I'm thinking, well, then maybe we need consultants. You and I go in as consultants
Yeah.
and set their practice up, do the evaluation of their business. And if they really care and they really want to expand their knowledge into the dental world of neurology where they should be going, working with a team and working with, a group of practitioners in collaboration to expand their care, then we can, as consultants, help set them up. We know what to do. Um, it's just a matter of being hired. And I think that, we haven't even talked about this, Shirley, but, even a web page or whatever, where they just hire us. And, even if it's a phone consultation to discuss their evaluation of their business, this is something that is not going away. I don't see it ever going away.
Right. Right. They don't know what to do with the scan, and that you have this software now that overlays on top of the skeleton. What is it called? Zygote or whatever.
Yes.
Software is part of your software where they can really
Yes.
like point even
Yep.
what it is they're looking at. I think would be really important. I think that might be part of the missing piece. And again, you've got a solution, but nobody knows it. So it
Well,
reminds me of a cartoon. Get this. So it's a guy, so it's a cowboys and Indians situation, like from the 1960s, where all the cowboys are like
yeah.
trying to get at the Indians, and the Indians are there with all their bows and arrows, and then the cowboys are there with their six shooters, and they have to and there's somebody's at the door of the hut, and they're like, so the cowboy is inside the hut. The salesperson is knocking at the door with one of the rat-a-tat guns, with 1,000 bullets in it. And he's like, "No, I don't have time for any salespeople right now." So that's kind of like what I feel like right now. Not that I have anything against American Indians or how the Cowboys were, blah blah blah, and all that PC stuff aside. The problem is that we have a really good solution here,
Yeah.
and we have a collaborative solution. It's not like a buy it and you're done and you're in your silo again.
This
You
is
have
ongoing.
a reason to be communicating with others.
Well, it's going to enhance their business that they can
Oh yeah.
advertise on their website. It's one thing to advertise dental sleep. I haven't yet seen dental sleep really curing people's issues, from what I've seen in the scans. They're dabbling. What we need are programs of assessment. That's the key right there, is really listen to the patient, take their information, and find out where they're at and where they want to go, and let their journey guide them. I think too many times we look in the mouth, we decide their journey, we decide, what is next to be fixed. And what we're doing is destroying the neurology communication and shutting their systems down. We're not even paying attention to the occlusal equilibration with the neck, and
Yeah.
we're just shutting systems down. And next, next,
Unknowingly
next,
or
next.
without thought.
What's that?
without a thought of a consequence of what
Oh,
is this
no,
crown doing.
none
Those
whatsoever.
dentists that did those anterior crowns was, oh, she feels so much better about herself, we really improved her smile, and they think that they really improved her life quality, but they jacked up her cervical spine and they didn't address the root cause.
No, and
So,
also in one of the areas when Dr. Smith was talking about in his video and really struck home to me is the sympathetic responses on the anterior teeth, the parasympathetic on the posterior teeth. And what we're doing is we're jacking up the sympathetic, and that person can't get sleep. So, I mean, you're sleeping in
and they're
sympathetic.
never going to think to themselves, oh, ever since I got these anterior crowns, I haven't been able to sleep.
No, no,
That's not going to get in there. It's
no,
never going to get in there.
no.
So it's like me, well, like, why is my sleep all of a sudden so horrible that I'm getting alarms in the morning from my sleep ring? And never thinking that I was used to having this certain level of potassium in my system, and now it was gone. So now now it's better. I still think there's something else going on, but at least that little, I never made that connection because I've never had any symptom relief from taking those medications, but the doctor wants me to take them. And I'm like, well, it's a very low impact on me. So I guess if you think it's going to melt my kidney stone, there you go. So,
Well, you know what's exciting about all of this is it's not just the neurology, but the nutrition
oh my God.
aspect of it, and the nutrition aspect, and also the emotional aspect of it as well. I mean, I was speaking with a therapist yesterday at dinner, and we were talking about dentistry and the effects that dentistry has on the depression on people and anxiety load that these children are suffering, and and autism. And it's just out of control. And the amount of anxiety these kids are suffering now is affecting their quality of life, and they're so young. And the midbrain is not getting the communication it should be because of the occlusal discrepancy from the TMJ and from the vagal nerve not getting the information into the midbrain. All you've got your theta and beta waves all messed up. And you look at the circulation in the neck, it's all messed up. So really dentistry
Because the
is,
tongue is in the wrong
the
place.
tongue is in the wrong place.
Sorry, I'm going to keep going back to it, especially with children.
Well, it's the neurology, right? And what you're talking about is sleep apnea, and you're looking at a lot of, I see this, limited airway opening is
Right.
huge.
Right.
And
It's
so
a huge problem. It's not
it's a huge
hugely
problem.
open.
So their
Yeah.
oxygen's not getting into the, so you've got all these contributing factors. Why can't, we teach a program to assess and really evolve dental into the collaboration with the brain? The dental is part of the brain, bar none. And until it's really recognized in the schools, I don't think we're going to have an easy time. Even with these associations, how much are they talking about the brain? Very little, it seems like. They're talking about structure and implants and support, Okay, that's true. We need to have that support, but at the same time, the neurology effect, and like one dentist, I like the way he called it, when you pull a tooth out, it's amputation. You're actually
If you drill
amputating
a
that
tooth,
nerve.
it's amputation.
Yeah,
We're the last, dentistry is the last profession that amputates infections. Every other medical specialty has an infection and they put some drugs on it and it's fine. Or there's another way to address the infection. Dentistry, we cut it out with a drill or we rip it out with a pliers, and then we call it dentistry or we call it good. But you're right. It's complete amputation. Dentists
it
hate that
spreads.
word.
Right, and infection spreads. And so
Yep.
really the body, we have our work cut out for us, and the
Yep.
discussion is the future is how to, get the conversation started, like you said, how do we begin this conversation other than maybe start a website page, or a blog page and just get the conversation in motion. Um, to me is the next step. I really, I really see you know, the side effects of not really addressing this is going to be detrimental, especially
Yeah.
to the mental health of these younger kids and the younger generations. And they say depression is on the rise. It's crazy on the rise, and anxiety. So, interestingly enough, dentistry is the part of it that is not being addressed, that can be to help solve this part of the care of the person's lifestyle and quality.
It's got to be part of it. It's got to be part of it. And there's so much to say about the nutrition that
Oh,
we're going to
yes.
have to put that on our list
Another
for a
another meeting.
future episode. It might be three different episodes here because it's a huge problem and a huge topic, and it's showing up in all different kinds of places. So we're moving on an hour here, and so do you have any final things that we wanted to say with respect to what kind of camera are you using and is it easily purchased and blah blah? Does it have
Well,
to be a certain kind of camera to go with your software?
well, the camera I like to recommend is handheld because in an operatory you want something very mobile and portable, and actually fits inside an operatory. You don't need a tripod, or you don't need a stability.
Right.
You can actually hold the camera. I've got some images of a dental hygienist taking the images of while a patient is sitting in the chair, like you would an X-ray machine. You just show
Yeah.
it on the side, the front, and the side, and then the back of the neck. But you're going to collect the information and then you download it with the cable into the computer, into the system, into the desktop. Takes minutes. Um, by the whole time we and by the time we take the images and download them, you're looking at 10 minutes, something similar to x-rays. And the nice thing about it is that you have the colors of the soft tissue. So versus the black and white of an x-ray. Um,
Right.
so the software actually uploads it into their system, and you can right away show the overlay with the 3D system software with the thermography images. And I would say somehow, in to put it into the mindset of the dental practices, start thinking out of the vortex and looking at these assessments as part of your income stream, not just an assessment to fit in so that you can, bill out your crowns and your implants. You want to look at the whole person and start taking time and billing out these assessments. We can with cross-code billing. I saw that you could bill out between $500 to $800 for these assessments in an hour. That's a lot more than I can bill out for scaling and root planing, and I sure like the break, you know.
Yeah.
So if you're paying me $50 to $60 an hour and you can bill out between $500 and $600 that hour for the assessment under a medical code because of the cross code billing, this is something we can show the offices how to do. Why not? And now you've got, like you said, you've got information for full mouth reconstruction or full head and body, or working with your team.
Yeah.
And what's interesting that these dental offices don't understand yet, they're going to have referrals from the dental for the dental aspect of it that the chiropractor
Yep.
can't fix, and the naturopath doctors can't fix. They're all going to get so busy that they will have to turn people away. And that to me is where you want to be. You don't want to have to be struggling to fill your schedule. You want to be able
Right.
to say, well, we're so full, our waiting list is X amount.
Yeah. I'd rather have a waiting list
We have a
right
waiting list.
now.
So this to me is inevitable. I see it. I already have seen it with some of these doctors that are working in this team environment. They're turning away patients. They're not even taking new patients. That's how busy they
Yeah.
are. So there you
Well,
go.
we should all we shouldn't all be that busy, but certainly we should be part of the solution and include this kind of intake information. And dental hygienists can use this information. I'm thinking of a new patient I had this week. Doctor, 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 this tooth hurts, nothing's wrong. This tooth hurts, nothing's wrong. This tooth hurts, nothing wrong. Well, it was wrong. And she was just aware of it being a problem before the x-ray showed the problem. And then she gets the head patting. She gets the, maybe you just need a psychiatrist, or maybe you're depressed. She gets all of that kind of fudge. Where if you had a thermal image of that
Oh, you would
tooth,
see it. You would
you
see
would
it
see it right away.
right
Why,
away. Yeah.
why just belittle the patient? They know what's going on. They've been living with that tooth for a long time,
They live
60
in their
some
own
years for
body
her.
24/7. Yeah. Well, you know what? Good point. When is it going to happen? When, when to start implementing this type of assessment taking is going to be up to us to get the word out, to get these offices thinking outside the vortex and into assessments for whole person care and into the neurology. And I think we need a list of services so that they can understand and see that their services are limited without neurology. And they're also they're skimming on their thread on thin ice because you're also looking at legal issues if you're not paying attention to the neurology which you were taught in school to utilize. And that's something that, I see more and more happening, especially with the internet, and people are getting smarter. They want the information.
They're
They
looking,
want
they are
it.
looking, looking,
They're looking
looking.
for it.
And why should they have to find me in Wisconsin, you in Las Vegas,
Right.
so
Yeah.
the dentist in North Carolina? And, why should they
Oh,
have to, and the chiropractor up here in Wisconsin, why? Why can't we have a nice little network of people of like mind where you're going to get
exactly.
treated appropriately right
Yes.
out of the gate? Please don't look around from a chiropractor. We know that this kind of chiropractor
Yes.
works. Look for this kind of
Yes.
chiropractor. Look for this
Yes.
kind of dentist.
Yep.
There's no board certification in airway. There's no board certification in crown and bridge. There
Mm-hmm.
is prosthetics, but even the prosthodontists are, they're not all the way aware either. That's a topic we've never talked about. But
Not
that
yet.
would be a good person to kind of loop in here because they're the ones doing the fanciest uh, replacements. So, in short, open wide, right? So, we want you need to include the mouth in your assessment and in your treatment plan. You need to be working with a dentist and or a hygienist and or a myofunctional therapist to kind of get all these pieces lined up together. We need chiropractic care. We need ENTs that are not in their own silo and won't get out, and to open your mind, not just your mouth. It's really important that all of these ideas need to percolate through into your brain and wonder how you can get to your own solutions. We don't have all the solutions, but
Not
certainly
yet.
we have thought about this for a long
A
time,
long time. Mm-hmm.
a long, long
And
time.
and dentistry really is a family. We're no longer practicing on our own anymore. It's
Right.
over. That's over. We're now part of a family, and to start searching for this family. And if we can be part of that introduction for a website, let's
Mhm.
do it. Um,
Let's do it.
to vet these like-minded practitioners. And that's what Dr. Linxs, I started with Dr. Linxs, to put this kind of like-minded attraction there for such cases and in courses. So we're on our way.
We're
It's
on our way. And so your website is Dr. Links.
links.com, linxs.com. Mm-hmm.
Okay. And mine is primalair.com. And you'll see a pop up in there for the book called More Than a Kissing Spot, Your New Baby's Face, which kind of gives you an idea from the very nugget from the
Yeah,
from conception pretty much on what the mouth is supposed to do and how it contributes to overall health. So those are all the things that well, there's not all the things because it's only been an hour, but those are some of the
it's a
things
good
to get
start.
you launched into this way of thinking and to open the idea of how we can do more in kind of a kaleidoscope of collaboration. Thanks,
Absolutely.
Victoria.
Thank you,
Have a good
Sherry.
rest of your day.
You too. Bye bye.